call to order the meeting of the Fire and Police Commission on October 26th at 4 p.m. Ms. Clerk, can we conduct roll call?
Commissioner Herlinger?
Present.
Commissioner Hill? Commissioner Jones? Vice Chair Dozer? Chair Rodriguez.
Here. Can I remind commissioners that when we are speaking, if we can push the microphone so that folks who are not in the audience today and watching on TV can hear what you have to say. Ms. Clerk and commissioners, are there any changes to today's agenda?
Chair Rodriguez, there are no changes to the agenda.
Okey-doke. Then we will move to item number 5. Ms. Clerk, do we have cards for public comments or hands raised for items not on today's agenda?
Chair Rodriguez, we do not have any public comments in person or online.
Thank you. Can you read the first agenda item, please?
Item 5, approval of special meeting minutes from September 28th, 2023.
Okay, are there any changes to the September 28th minutes? Nope. Do we have a motion to approve the minutes of September 28th?
Second.
Okay, we have a motion by Commissioner Jones and a second by Commissioner Herlinger. Any discussion or objections? And we can vote.
Motion passes unanimously.
Super. Can we move to the next agenda item, please?
Item 6, City of Santa Barbara Advisory Group Decorum and Purview Training.
Hello, Chair Rodriguez and Board. My name is Sarah Gorman. I am the City Clerk Services Manager, and I'm here to talk to you about Purview Communication and Conduct Essentials, and I'm here with Human Resources Manager Graciela Reynoso. So I'll speak for a bit, and then we'll hear from Ms. Reynoso, and then back to me. And we'll have an opportunity for questions at the end. All right, so we are going to be talking about a couple of things today. We'll be talking about the role of boards and commissions or advisory groups. Most cities or public agencies call them boards and commissions. The city of Santa Barbara is a little bit special in many ways with our boards and commissions, and we call our boards and commissions advisory groups, but they mean the same thing. We'll talk about communication. We'll talk about conduct and decorum. Talk a little bit about anti-harassment training. And we have a half hour booked for this, but good news, I suspect it'll be substantially shorter. Unless you have a lot of weird ethical conundrums you present to me from the dais, and I hope not. You don't need Mayor Randy Rouse. All right. We do give this presentation to a number of the boards and commissions. So we have a kind of dog and pony show going to a number of boards. So this is the same presentation that we give to a number of boards. So boards and commissions / advisory groups are vital to public agencies and particularly really important to the city of Santa Barbara. Some cities might have 3 or 4 boards and commissions, planning, parks and rec, arts, call it a day. But Santa Barbara is not like that. We have over 30, over 40 boards and commissions, depending on how you count them. They are established in the city charter. So going back to the city charter, it is baked into the city that there will be public input into commissions who are providing advice and counsel on specific areas where the commissioners have expertise and providing counsel to the city council on those particular topics. So it is particularly critical to the city of Santa Barbara to get public input in this way and to get the expertise of community members on these particular topics. So the city has plenty. We have over 40 boards and commissions. And the council delegates advisory and decision-making authority to various boards and commissions. And importantly, each commission has its own important role on particular topics. So there's a water commission, there's a Parks and Rec commission, there's fire and police, there's a number of design review commissions. And this is set up so that water commission members will be people that become experts in water and provide advice on that particular topic. So it is extremely important that each board provide advice within that specific category, because we have these particular categories for particular types of input. We want to make sure that each board is providing advice and counsel within that particular subject matter. So the appointed board members are representatives of the city. Thank you very much. You may not hear that enough. We really appreciate your service. The boards and commissions are meant to increase participation of various community interests. It provides a lot of openings for members of the public to participate being on a board. And having the number of board meetings provides opportunities for the public to speak directly to the boards on these specific topics. A role of the boards is to engage the community and, as I said, provide advice in that specific area. And as I said before, to remain within the purview and authority of your commission or your board. Conduct. None of this is going to be surprising. Expectation is to conduct the city's business in a professional manner. You're here in council chambers. It is an impressive room, and you're sitting literally up on a dais. It can be intimidating to the public to come and speak and to see people in this room. You want to make sure that you are treating everyone who comes before you fairly. Some people who come before you speak before boards all the time. And that happens particularly in, say, the land use boards and community development, where you might have architects that come all the time. And sometimes you have people that come just for one specific issue. They are truly invested in one particular thing, so they're coming out for that. And make sure you are treating all those people who are coming before you fairly, whether they are speaking confidently into the mic or not. So serve as a leader for civility and decorum. You are in a special position up there on the dais, so be decent to people. Be welcoming of civil participation and engagement. And in general, do your homework. Prepare in advance. Stick to the agenda. We live and breathe by the Brown Act and making sure that everything is agendized that's discussed. As a city clerk, my daughter will reference, "Oh, it's agenda, Mom," on the Thursday that we're publishing the agenda, that everything is very, very rushed because we want to make sure the agenda is right. So stick to the agenda that's in front of you. Be respectful of each other's time. And that can happen in a couple of ways. One is if you feel like you are speaking so much on the dais and it feels like other members of your board aren't having a chance to speak, give them a chance to speak. And on the other hand, if you feel like you have something to say, then make sure you're heard. Make sure you're requesting to speak and you're having your voice heard. You're appointed for a reason. And don't be distracted. I'm very proud I left my phone back there. I know right where it is. I'm aware of it. Don't have my phone next to me. So it's also hard for us now to focus on what's in front of us. But do. This is an important occasion, and don't be distracted. And now, Ms. Reynoso.
Thank you, Ms. Gorman. Again, my name is Graciela Reynoso. I'm the Human Resources Manager here at the City of Santa Barbara. And I'm here to talk to you today because part of my role at the city and part of HR's role at the city is to ensure a positive organizational culture that is, again, positive and thriving for people. In that role, and in an effort to do so, we point to some documents, both with employees and with commissions, and in manner that we want to behave with the public and amongst internal and external customers. One of these documents is listed here. It's the Excellence in Customer Service Code of Conduct, which is an affirmation of the city's commitment to professional treatment of one another and of the public and of the community. So this document you receive in your orientation packet. We also have another document that's called the Organizational Values, and it outlines similar tenets of being respectful and professional in our conduct. So training that we provide to boards and commissions, we're calling it Purview and Decorum and Communication Training. We also provide a lot of training to employees and staff to make sure that we are aware of the best practices in business conduct. Next slide, please. So the Code of Conduct really addresses a number of topics such as, being respectful and patient, treat others as you'd like to be treated, so the golden rule, right? Practice active and respectful listening. Oftentimes, when we do training, we really hone in on the fact that in a conversation, oftentimes, we're not really listening. We're waiting and formulating a response. And to get to really listening, it gets a long way to effective communication. Another thing is monitoring our tone of voice and our body language. So I've seen studies where 97% of communication that's happening is really body language and voice tone and not the choice of words. So people, as Sarah said, could be intimidated coming in here, and so they're going to interpret tone and body language in a way that may bring them stress. So obviously we want to treat people with respect. And remember that it's okay to disagree without being disagreeable. In an effort to really enhance our civic and civil treatment of employees and vendors or anybody who does business with the city, constituents, et cetera, we do have a couple of city policies that I'd like to reference. And the first one is pictured up here. It's the Workplace Non-Discrimination, Anti-Harassment, and Anti-Abusive Conduct Policy. So this is a policy that was updated in July of this year to include anti-abusive behavior. Anti-abusive behavior could be otherwise known as bullying. And we've seen as social media has thrived and right when social media was new, for example, there was a lot of bullying and really no checks and balances on that, and the public really wasn't standing up to that. And we see the detrimental effects of bullying. Next slide, please. So bullying and abusive conduct, if we use them as synonyms of each other, we have some examples here, such as yelling and belittling and having that condescending tone of voice. The effects of the bullying is that folks kind of withdraw from a process. So as an organization, we clearly want to take actions to train folks in manners that would not cause people to want to drop out of the process or not fully engage in either their employment cycle with us or in conducting business with the city. Next slide. And back to Ms. Gorman.
All right. Chair Rodriguez, and the rest of you can listen also. We'll talk a little bit about the role of the chair. So the chair sets the welcoming tone to staff and the public before the board. The chair is responsible for order of and conducting the meeting in a fair and efficient manner. And we just want to remind the board of the strong value of taking a brief recess if it's necessary. Sometimes it can be very helpful to just say that you're taking 5 minutes, and if it ends up being 10 minutes before everybody comes back, that's okay. It can be a really powerful way to take the heat out of the room if things seem to be getting a little out of control. And so when things are a little stressful or hard in your work as a commissioner, you can remember this beautiful sunset picture, Santa Barbara. And as you were already planning to, conduct yourself as a representative of the city, being courteous and welcoming of others' opinions. So we're here for questions.
Just want to start by thanking you. I know that we had you on the agenda and you showed up, I think it was June maybe, and then the meeting was canceled, and I know your time is very valuable and precious, so thank you for arriving then and showing up then and for this presentation today. Are there any questions or comments from commissioners? Commissioner Jones?
Good afternoon. Thank you both very much. I do have a couple quick questions. Ms. Gorman, is it? Did I have it
Yes,
correct?
hello.
Thank you. With regards to the advisory groups and the various boards and commissions, is it common for citizens who participate in those capacities to do so in multiple advisory boards or commissions? Or is it more the expectation that you're doing fire and commission, that's all you're going to do, or is there overlap?
I would say it's reasonably case by case. It's quite rare, but I've seen it occasionally, but it really depends on a lot of different factors.
Okay. Can you give me an example of the factors?
I'm trying to think if there has been a person who's been appointed to multiple. For example, I'm thinking now of, there was a person, I think, who was on both the city library board and was also the representative of the city on a county library board.
Okay.
That kind of.
So there's like a correlation generally?
Yeah, yeah.
Okay.
Yeah,
Sure.
and it can be, it also can depend on time commitment. Some boards meet all the time and some meet once every quarter. So that can be
Right on.
part of it,
Thank
too.
you. And my
Chair
sec-
Rodriguez, if I could add too, we've had one commissioner was on fire and police and then also served harbor commission. What you don't want to do is, and it's kind of hard to do, is where more of the concern is actually outside, serving on a board or commission for the city and then another entity or county where a potential conflict could be. That's the biggest concern, but usually if it's like intra-city, you can probably serve on multiple boards. That's happened before.
Right, thank you very much. And my second question is, for the customer service code of conduct, is that crafted by the city council? And I'm curious as to whether or not this, what the process would be to suggest an addition or amendment to that.
That is a document that's existing and was brought forth, I believe, by City Council, but that may be something that we'll need to research. There was a task force, and it's from a while ago. It's from like the 1990s.
I think it's at 97. Yeah, okay, thank you so very much.
Commissioner Herlinger?
I served on the Rental Housing Mediation Board for the last 15 years. So I'm the example.
Thank you, Commissioner Herlinger. As you rung in, I thought, oh, wait, isn't he reapplying for rental housing? So, thank you.
Any other questions from the commission? Could you clarify something? So the advisory capacity, and this has been I think a continual conversation, and I kind of fumble when I try to describe it to others. The advisory capacity of a commissioner in any commission, what is that role if the commission can't direct staff? What does that position actually mean or do? How are they the voice of community if they can't direct staff?
I can speak to this, or Mr. Doremus, if you'd like to speak to him.
So, Chair Rodriguez, it's a really good question. It's kind of been a crux of the issue of a lot of commissions and commissioners and the concerns and where's the line. And that's kind of where I talk about the draw of, needing to be courteous, because you're acting as an advisory, as a support for that entity, for the fire police department, for the police department, for community development, whatever board you serve on. And if you're there as a support to provide advice, you never want to have a contentious relationship. You always want to be respectful to staff, because who wants to listen to someone where there's a controversy? So the commissions do not have the ability to dictate or order staff around. That falls to the city administrator and then his or her delegates, or their delegates. That's based on the charter, right? So the city charter provides that they appoint a city administrator, and the employees, which are staff, are then descended from there to go on to department heads and so on. So city council nor other board or commission could be directing staff on matters, because when you're providing direction, you're acting as basically potentially as an employer capacity. City council can do so for only two positions. That would be the city attorney and city administrator. So that is why we have that there, because of those charter requirements and what the charter says of commissions. They are an advisory body. So where it comes into help is like where you can talk to staff and establish a dialogue is, how can we best serve you, and what sometimes there could be an exchange of information or needed to help provide the information that you may need, right? Because you have community output, you talk to community, listen to community members. So you, as part of that role, you're working with staff to provide different viewpoints, opinions, your backgrounds, your expertise, to help staff when it comes to policies, when it comes to, budgetary items, to also be an advocate when you go in the budget process to council. As we're sitting here with the fire department, we're sitting here with the police department, we're understanding their challenges. We feel like they need the budget, maybe an increase in budget to deal with this issue or that issue. That's important for the community. So that's one of the most important roles, right? Because you're understanding the issue, you're part of that issue, you're working with the departments on those issues, and therefore you can speak to council when you provide recommendations, because you're not just providing it to the departments, you're also providing it to city council, that there may be a budgetary issue, you may need to find some money for this source to deal with this issue in the community. That would be a help. So that's kind of the role. I know it's a lot of gray area when it comes to that, but that's why you're not allowed to, in terms of administratively direct staff because of the charter, but where commissions and boards can help is kind of that area that I described.
So I'm thinking of a few years ago, I think maybe four or 5 years ago now, and this was when the commission was comprised differently, and we didn't have a city administrator role or position on this commission. And the city administrator's office was doing their budget preparation and felt like, I think they were doing cuts at that point. And the Fire and Police Commission recommended to City Council that they rehire the Listos Liliana's position full-time. So that went against the city administrator's office because they were, that was in conflict. City administrator's office said we didn't have the money, and then Fire and Police Commission said, we need this program. It ended up being, a state-recognized award program, so it was ultimately a really good decision. And I'm trying to think of what would that look like today if we're so connected to the administrator's office. Would this commission today have been able to recommend something that was against the city administrator's recommendation?
Chair Rodriguez, so I don't think that issue has anything to do with regarding having a liaison who comes straight out of the city administrator's office. So for example, on the budget issue, if a budget's being proposed by the police department, they work in consultation with the finance department, with the city administrator's office. And when the city administrator is doing a budget, it's not just, it's holistically, it's looking at the entire city instead of just one department. So they will have their reasons why. If the commission feels there's a need for like that position, for example, and explains why, they can do so. That just happened recently to city council with the library board, or the council where they made recommendations to the city council to not make the significant cuts that they did, and council listened and made adjustments to that. So the commission still has that authority and the ability to do so, and the key is to articulate the reasons why and support that, which, for example, Fire and Police Commission did in the example you gave, the library board did for the examples they gave. So that ability is still there for this commission to do so.
Okay, super. Thank you for that clarification.
And Chair Rodriguez, I wanted to reiterate that. So there are details included in the ordinance about how the commission can make public statements. And so you can make a motion at any time, second that motion, take a vote to make a public statement on behalf of the commission. That can be drafted because you advise city council just like you advise the city administrator's office.
Okay, super. I think that one is always going to be a little, cumbersome to try to explain. So thank you for that. Did you want to add anything more to that?
No, that was useful. Thank you, Mr. Noyes. Thank you,
Okay.
Chair.
Super. Any other questions or comments from the commission? Okay, do we have public comment in person or online for this item?
Chair Rodriguez, we do not have public comment in person or online for this item.
Super. Thank you so much for coming. And can we move to the next item?
Item 7, overview of the impacts of the opioid epidemic in the city of Santa Barbara and the use of opioid settlement funds.
Good afternoon, Chair Rodriguez and members of the Fire and Police Commission. I want to take a moment to introduce the staff that I have. Oh, Lori, come on. I'm all the way up. We're going to take the lead on this, but we also have, we have Chief Mills to answer anything that is related to the fire department. But just for the flow of the presentation, we're going to also give the fire department numbers. Don't worry, we pre-agreed to it. But he's here to answer anything at the end if it's a fire department specific question. But just for the ease and flow of the presentation, we're going to take the lead on it. So to my right, I'd like to introduce Commander Sean Hill, who will give a majority of this. He oversees our Detective Bureau, and as part of that, oversees our Special Investigations Unit, who handles narcotics investigations. So with this settlement money that we're talking about, he is our lead for this project. So he's getting up to speed and we're making good headway in that area. So he'll take the lead on the presentation. And then I also want to introduce our administrative manager, Lori Peterson. She oversees a lot of our professional staff, our business office, our records bureau, our IT staff. So she is what we consider command staff, but on the professional side. And like I said, she oversees a lot of our professional staff. So she'll just give a quick overview on the financial piece and numbers of it. But I also, as we have opportunities, I want to make sure that I'm introducing a lot of our vital staff besides our line level and those that you get to see every month, but some of our different staff as we give different presentations. So with that, I will turn it over to Commander Hill.
Good afternoon, Commissioners. Thanks for having me today. I want to introduce the framework so we can have this conversation and get input from the Commission and the public, and I appreciate the opportunity to do that. I would like to start with kind of painting a picture of the gravity of the situation that we're going to talk about. Earlier this week, I was at a summit where I sat with family members who lost children to fentanyl overdoses, and it was quite impactful. And to give you an indication of the dangers of the drug fentanyl, which is in large part of what we're talking about in this conversation, it takes the weight of 3 grains of sugar to kill a human being with fentanyl. So the weight of 3 grains of sugar, that's the dose that we're talking about that's lethal for human beings. So framing that, if I do my job well, I'm going to give you kind of a visual, an idea of some statistics of what we're dealing with in the community, and then also speak to the opioid settlement and how that is going to impact and is designed to help us in the community with this problem that we're having. So today's agenda is going to be the brief overview. I'm going to talk about the overdose trends, opioid settlement, and then I'm going to talk a little bit about allowable and unallowable expenditures for the settlement. And then we'll give a quick update on fund allocation. So the slide that you see right now is just to paint a really broad picture for Santa Barbara County, and that is from December 20 to December 2021. And as you can see, the number per rate of 100,000 people in the population, the rates of overdoses are pretty significantly high, and Santa Barbara is sure in that high number. I'm going to bring this down a little bit more specific to the year 2023 year to date to give us an idea of what we're seeing in Santa Barbara County. And as you can see, this is years 2021, 2022, and 2023. There is an increase trend generally. However, you will see that it appears, although this is year to date, it appears the numbers are a little bit lower for this year. And although we don't have an empirical experiment to tell us what's happening, we do believe that that's because of education, public education, and the ability for the community to have Narcan as a resource. And I'll talk a little bit about what Narcan is in a little while. This is the county overdose deaths divided by north and south, just to give you an indication of what it looks like between North County and South County. And again, these are all going to be graphs 2023 year to date. This is broken up by race. And if you can't see the small print, the blue bars are white, the gold bars are Hispanic, the silver bars are black, the orange bars are Asian, and the darker blue are American Indian. And again, broken down by age range, same 2023 year to date. It gives you an idea of the average age range. I'll give you a second to look at that for each year. As you can see, we do have a trend with the highest age range being around 39 years old. So it is moving significantly younger. I'm going to do my best to cover a little bit of information from the fire department because we're here as partners. And we're going to talk about Narcan. And this is what I was speaking to earlier. This is a drug that allows us to combat the fatal impacts of opioids, specifically in large part fentanyl, but all opioids. There have BLS, there's only been, for the scope of practice for BLS is basic life support. They've been using that and had the ability to use Narcan for about 6 years. Narcan's a drug, and historically, basic life support providers were not allowed to use drugs or provide drugs with the exception of oxygen. So this is pretty new for the field in emergency medicine. And prior to that, it was only advanced life support or paramedics that were allowed to give the drug Narcan. Now naloxone is carried on all Santa Barbara Fire Department responding apparatus, as well as all law enforcement officers in the Santa Barbara Police Department. The fire department operates as an EMS agency, correct me if I'm wrong. So they operate under different regulatory body to issue Narcan and provide Narcan than law enforcement. Narcan for law enforcement is just a separate legal statute. I won't read through all these numbers, but to give you an idea of what some of the statistics are and look like. And again, I think you'll see the trend that I mentioned earlier. In October 2021 to September 2022, the total naloxone administrations, that's just Narcan, the administrations were 91. And looking at fire department responses when they conduct basically a search in their texts for any time naloxone was discussed in a report, it came up 232 times. So let me explain that for a minute. The administrations is when a firefighter, medic, or BLS provider were giving Narcan to a person who had overdosed. The documented naloxone use on scene is also potentially when it was given prior to the firefighter's arrival, and that the firefighter would have documented that it was used prior to their arrival. So you can see the number of uses is much larger than the number of administrations by firefighters. For the next year, you can see that the total administrations by the fire department was smaller. And again, this is year to date, but it again appears to be trending a lower number. And again, both fire department officials and the police department also agree that we think it's very likely that this is because it's more accessible in the community. And oftentimes there is what we would call a dark figure of administration. In other words, it's not reported to us. People are using Narcan and never calling 911, and the people who are administered are never going to the hospital. And that's very much possible with the way Narcan works. To give you an idea specifically to police department statistics, we started deploying Narcan in 2019. We partnered with Pacific Pride, who really helped us get a supply of Narcan. We didn't have it at the time, and they've been a partner with us ever since. And between 2021 and 2023, we responded to 360 calls for service where Narcan was deployed. So that is, just as I spoke to the fire department, not only when we administered our officers, but also when it was administered by someone else in the public or the fire department. And just another way to look at this deployment, and you can see the trend moving up from 2019 to 2023. And again, although this is year to date, we're expecting a slightly smaller number. And again, we do believe it's that dark figure that we're talking about, where Narcan, and when I say dark figure, I'm not to imply that's a negative thing. What I'm saying is the community has a lot more Narcan at its fingertips, and it's saving lives. Thought it would be helpful to see a heat map of where Narcan was deployed or reported. And this is the police department's documentation from January 2021, 2022 year to date for 2023. And it gives you an idea of geographically where Narcan is being deployed in the city. I want to speak briefly to the opioid settlement. And essentially, what happened is 5 large pharmaceutical companies came to a settlement due to the, in part to the over distribution of opioids that has caused a lot of the issues that we're seeing. And they have reached a settlement in 2021. And there, in total, I believe there's actually 5 pharmaceutical companies, and they all are responsible for different amounts of the settlement. It can get a little bit complicated, but the best I can describe it is we have basically 5 pharmaceutical companies. They're all having to pay out for opioid remediation and recovery efforts. They're all having to pay out different amounts of money, and then that's being distributed to a variety of different agencies. The police department is one of those agencies. We have begun receiving the funds, and in a few minutes, Laura Peterson will speak to that. Really importantly, I want to talk about allowable expenditures, and maybe even most important to a lot of the people that are listening, unallowable expenditures. Allowable expenditures must be tied to ending, reduction, or the lessening of the effects of the opioid epidemic in the communities, and they include prevention, intervention, harm reduction, treatment, and recovery services. That's the primary focus of what's being allowed. The allowable expenditures are broken up into 2 sections. One's called the high impact abatement areas, and the other is a list of opioid remediation uses, or the core strategies, and that's where we really get our specific approved uses. I'll speak to those 2 sections really briefly. The section 1 is matching funds for operating costs for substance use disorder facilities, expending SUD facilities, addressing needs of communities of colors and vulnerable communities, for example, unsheltered, as well as interventions. Section 2 really starts to dig into what the core strategies and the specific uses are. So Narcan, obviously being highlighted here, is a drug to reverse opioid overdoses, and that's saving lives. So that is one of the approved uses to the purchase of Narcan. Medication-assisted treatment and distribution and other opioid-related treatment. Pregnant and postpartum women who are impacted by opioid abuse and disease, expansion of warm handoff programs and recovery services, treatment of the incarcerated population, prevention programs, expanding syringe service programs, and evidence-based data collection and research, analyzing the effectiveness of the abatement strategies within the state. This is a selection. It's much broader than that, and this document is actually probably 30 to 40 pages long. But this is to give you an idea of what the spirit of the settlement is. Specifically, examples of approved law enforcement activities would be education training for first responders related to opioids, diversion activities, warm handoff and overdose responses, naloxone purchase and distribution, treatment with corrections or transitioning into the community, drug take back and disposal, and wellness for first responders, specifically related to opioid response. And as I mentioned, equally as important are unallowable law enforcement activities, and that would be the search and seizure or testing of illicit substances, equipment or personnel costs for gathering evidence or prosecution of potential criminal activities, so like drug enforcement specifically, officer health wellness services if not specifically geared toward opioid-related harms, and training unrelated to opioid remediation. So you can see there's a very clear direction that this settlement was geared towards as far as what's allowable and what's not allowable.
So this is the one slide to just give you a general idea of what we have received to date from the settlements that have been implemented. There are 3 of them at the moment. The names are up here just because they get referred to in the public in various different ways, and so I tried to kind of present them as the way that I've heard them the most. We've received distributions from all 3 of them, and we anticipate at this point, kind of based on those payouts and the schedules, that it'll be about $100,000 a year for settlement funds that will come in to be able to be used towards the programs that he was just talking about. These programs are required to have an annual report out, and so that process is being managed by the California Department of Health Care Services. The programs, it's an online, you go in and you fill out what you received, what you spent it on, and then they present the reports as a statewide report. And so the agencies don't report out individually on it to the settlement areas or to the settlements themselves. The state manages that part. The payments aren't processed through the state, though. The payments come straight to the city. So we've opted into the programs and we receive that directly without the state having to touch that money first.
Thank you for your time, and we're available for questions.
Thank you. Are there questions from the commission? Commissioner Herlinger?
So that $100,000 a year for how many years?
Each of the settlements has a slightly different number of years. It's ranging anywhere from 9 to 18 years. So some of them have a shorter payout period. Overall, the average is going to be about $100,000 a year. At the longest term, it'll be 18 years.
And just to give a little more light on it, this is why this is a moving target for us. That's why how we spend and what we do and how we program these funds is challenging, because we don't actually know. We know what we've gotten. We know what we think we're going to get, but it's not like we have a guaranteed check that we get every month. We get random checks, and poor Lori has to then figure out, what settlement they're coming from and how we're going to report on them. So that is part of our challenge at this point as we move through it. We have to do more short-term planning versus long-term because we actually are not quite sure how this is all going to look. So I just want to give that for perspective when we talk about how we're thinking about using them. Coming up with a longer-term program is actually problematic for us at this point because it's much harder to program when you don't know exactly what you're getting. Mm-hmm. Because the settlements vary, all the checks vary, not a single check is the same. And so this is our best effort to project out based on what we're seeing now. So I just want to clarify that point because I think that's an important point to really get across is this is not an exact science.
Commissioner Dozer?
Thanks. If I understood it correctly, and please correct me if I'm wrong, some of this money can be used towards treatment. Is that treatment that the police department works in conjunction with other community agencies, or do those agencies receive funding, or how does that work?
So, Chair Rodriguez, Commissioner Dozer, there's a lot of different entities that are receiving money. So take, for example, the county is receiving a large chunk of money. So most of the treatment services in that piece is programmed by the county because that's where those services are being offered. So for us, we don't want to get into the treatment business. We want to stick with the piece where we can affect our community with what we're doing. So for us, we're looking at, how we can more distribute naloxone more to the community and what programs we can institute locally, similar to, let's say, take for the sheriff's department, they're now doing it at their station. So the public can go into a station, take a short training video and get Narcan. So we're looking at what our options are on how we do that for our community specifically through the police department. But in terms of the treatment programs, as we know, trying to set up a treatment program for that dollar amount would not be something that we can do. The county is coming up with their own plan, and as part of such as CADA that we attend every month and different pieces and the Fighting Back Coalition, we're all communicating and making sure at the county level, we're all doing different pieces of it, but yet working together. So that's kind of a long answer to the question.
Do your officers currently carry Narcan? Every officer currently does?
Yes,
Okay,
every
thank
officer
you.
carries Narcan. It's deployed regularly. So,
I'm sure it is.
in fact, the sirens that you heard as we were starting the meeting were, the officers were responding to an overdose right here over by City Hall. So that is almost a daily call for what our officers respond to, and they all carry Narcan.
If I could just paint a little bit more picture for follow-up for that. It's generally the case that we deploy more than one dose of Narcan. Usually 2 is enough to combat the lethal dose. And additionally, just so you know, there is no negative effect, no negative health effect to administering Narcan. So oftentimes our protocol will say if this person has these conditions, we will give it. And if it happens to not be an overdose, there's no negative impact.
Commissioner Hill?
Yes, so if I understand it, so far, the police department has received $250,154. Is that what that number refers to? Could you give us a rough idea among the array of options that are on the sheets that we have here as high impact, remediation, et cetera, how that $250,000 is allocated?
We haven't spent any of that $254,000 at this point.
Oh, that's easy.
Yes, so that's why part of this process is getting input as we develop our program, but we've had to spend some time figuring out how much money we're getting, the financial piece, the reporting piece. I can tell you we're actually ahead of the county. The county, I think, is not going to even release their preliminary, what they're going to do with the money until the beginning of 2024. So this is our opportunity. We're coming to you first, and, and that advisory part that we were talking about and getting your input as we move forward with this. But for us, we're looking at specifically a couple of things, how we can get more Narcan into the hands of our community and some other things that we can do directly with this. Narcan is not cheap, so there is a piece to go with that. I think a dose at this point, I think is, correct me if I'm wrong, but I think it's $55 a dose. So making sure that we can not only supply our officers with that, because we don't have another source of funding for that, and we've been very fortunate with our partnership with Pacific Pride up to this point, but also figuring out how we can get that into more hands of our community. There are more than one story where we'll respond on a call where a parent will have given Narcan, or a friend will have given Narcan, or a complete stranger who had Narcan will have given Narcan. And when Commander Hill talks about, there's a lot of times at this point that we actually don't respond at all because we never get called. They give that dose and then they don't feel like they need EMS services or police services. So we're looking at different ways that we can impact the community, whether it's, through training, whether it's through the distribution of Narcan, but how we can best and most effectively use that. And that's our goal, but we haven't used any of those funds yet.
Is it your anticipation that you will come back to the commission with sort of an allocation proposal of how you visualize using these funds, or how would we be able to input into that analysis and discussion?
We'd like your input now on what that's the purpose, like what things you would like to see as we move forward with this this process. We clearly have some things in mind that we want to do, but this is where we're here asking for what your thoughts and opinions are on this process.
Well, the choices among the long list of things here are so diverse, and the background necessary to be able to analyze whether or not they're needed or not needed is not something that's before us. So I personally wouldn't be able to make any competent recommendation.
And we're just seeking public input on what we would like to see. So because some people have some really significant thoughts on, we would like to see more availability of Narcan. We would like to see you do more training. We would like to see you, that's really what we're seeking. We're not asking for the input on the granular piece of it. And we can always come back at a later time with more, once we work through some more things, and we can come back and say, this is the program that we're going to launch, and get, your thoughts on that as well. But this is why we're here, besides just educating on what is happening in our community. But we value the input of the commission and your perspectives, as the city attorney was talking to earlier, and that's one of the reasons we're here.
Okay, one more question in that range. It seems pretty obvious that maintaining a supply of Narcan sufficient for the use of the police department is a pretty central piece of the whole puzzle. And my understanding is that you currently do have supplies, but they're expensive. So is there a projection of, how much it's been used over the last year? Do you have any projections of what percentage of the funds are going to be needed just to maintain those supplies and the training of the officers with the use of the?
So all of our officers have already been through training.
Right.
So when we do it as part of field training, we have our own instructors. So at this point, it would be additional training that we would be looking to do specific to the use of opioids and how, different things like trauma-informed care and critical, CIT and other things, critical intervention training and other pieces that help our officers understand and deal with these situations better. So that would be one aspect of what we could. As far as the actual allocation for Narcan, we have been very fortunate in being able to get that donated through Pacific Pride at this point, but we know they can't sustain that forever. So part of that is now that we have some funding is be able to figure out what percentage they can give us or not as we work forward, through it. We definitely are not looking to take the entire, allocation to do that piece of it. And the thing with it, it also has an expiration date, so it doesn't just, there is a shelf life to it. So we just have to be mindful of those pieces. Like I said, we've been very, very fortunate to have Pacific Pride up to this point, but part of this funding will be used so that we can sustain this over the long term. But that won't be the only thing. So, we want to make sure that we can get it into the hands of the public as well as much as we can. So that is another big piece, and looking at, we didn't want to launch into a new program before we had this conversation. We clearly have thoughts and ideas. We would like to mimic a program similar to what the Sheriff Department has just done, where, like I said, you can walk into a sheriff's station, watch a video, and get your dosage of Narcan. So that is one of the primary things that we would like to do. But like I said, we didn't want to launch a program before we had this initial discussion with the commission, so.
And for clarification, I am hearing that this is not the last and only time for public or commissioners to provide feedback, that you're open to feedback at any time.
Absolutely. We are trying to be as transparent as we possibly can be with this whole, with this funding and with this program. So that's why we're starting here with this today, and really trying to come in at the beginning of this versus, well into it, and then, where we haven't been seeking input from the very beginning. So we're seeking input from the very beginning.
Thank you. Commissioner Herlinger?
Can you give us a sense of how much the county got? How much money the county got? And then is it allocated only to first responder agencies, or are there other agencies that can be allocated funds from this program?
So the monies are directed, the agencies that chose to participate had to let the settlement agencies and the state know that they would want to participate. If there was an agency who was identified as getting settlement funds, but they didn't wish to receive them, they could allocate them off to usually the county entity that was around them. So there has been some choices by other agencies to not participate in the program and make their funds available to other agencies to take care of that. So it's kind of you step up and say, yes, you want to participate, which we did. We got in line and we put our name in there, and we are directly receiving our own funds.
Okay,
But
so,
some agencies
but
did.
county, Santa Barbara County got funds.
Yes, they got their own funds.
Okay, so do we know if like, well, I guess the other contracted places would get money from, the other first responders, say in Goleta and Copper, they would get it through the county?
The county is
they-
coming up with their own plan on how they're going to spend these funds.
Okay.
I think
Commissioner Herlinger, as of the last report, 2023, they received 3.7 million
The
in their
county?
allocation. The
Got
county.
3.7 million?
Yes, yeah, they
Okay.
could.
And they can, and what kind of parameters do they have to be able
the
to
same-
distribute that?
It's similar parameters. It's the same parameters. It's from the same settlement sources.
Okay, so is it to first responders?
Not necessarily, no.
not specifically.
Okay.
So they get to choose how they're going to use it within their own county, within the county system.
Right?
The city made a choice on how it was going to, even prior to me getting here, on how we were going to do it here in the city with the allocation.
So are there other cities in the county that did the same thing as we did and tried to get money directly?
Yes, there were, I believe, Lompoc chose to receive their monies. And then I think there was a couple, I'm not sure which of the other ones chose to actually allocate their funds to the county. So there was a combination of some direct and some just reallocating back to the county.
Okay, so my comment's just about getting input that I would like to see from you, like what your priorities would be, that we could respond to that. And then also, the whole idea that I think there should be a lot of coordination between the agencies. A lot of this stuff seems to be, there would be overlapping, that we don't like duplicate some area.
Which is
That is-
the discussions that happen at Fighting Back and the other, we just got a big presentation from the county and who they have, and those are, all the different community partners are committed to talking and making sure that we're hitting all of the different populations and all the different needs. The county allocation is significantly more than our allocation is. That's why, we're not talking treatment or those type of things. Our priority, I can tell you, is getting more Narcan into the hands of
Okay.
our community. That is our number one priority, is in the hands of our officers and in the hands of our community. That is our priority with this money, is how can we make sure we get Narcan into the most hands that we can within the county? That is our number one priority with these funds.
Okay, so that's my, without us knowing what others are doing, it's hard to, the priority should be to complement whatever else is going on.
Absolutely,
That's
and that
my
is our
attitude.
goal.
Okay.
Our goal is not to do a program that others are already doing. Like I said, whether it's treatment or the other pieces, or whatever is being done, in the jail system, we're trying to look to what the need and the greatest need is for what we see in the community, which is to get in the hands of the community.
Okay, thank you.
Commissioner Dozer.
Yeah, I'm just curious if the settlement funds can be used to address all opioids other than fentanyl. I mean, is this something that you guys can use to address a heroin problem or things like that? Because obviously it affects different populations at different rates. I see head shaking, yes.
Yeah, the answer is yes. It is for opioid in general, opioids in
Okay.
general.
Perfect.
The reason that I highlighted fentanyl is because it is the biggest crisis that we have right now in our community. Sure.
Commissioner Jones.
Thank you, Commander Hill and Ms. Peterson. And I empathize with you, Commander Hill. I couldn't imagine having to be in a conversation with families and having to deliver such horrible news. So thank you for that, for the work. Most of my questions have been answered by the questions from the previous commissioners. I did want to follow up on the 9 to 18 years. And I know it's early, but it's never too early perhaps to start thinking about if and when these funds dry up, whether it's 9 or 18 years, if they've given any thought to what, because the need arguably will continue. If there's been any thought given to, what will happen after these funds sunset or other partnership opportunities.
I think, really time is going to tell. There's a lot of different initiatives at different levels, at the state level, at the federal level, to really address the opioid crisis, because it is a crisis. There's a lot of funding sitting right now in Washington, D.C. Hopefully that will, in fact, go through and move forward. So I think, my hope would be is that, yes, there will always be a need, but my hope is that it would be less of a need than it is now, that we actually are able to somehow address this crisis in a way that we slowly make a difference. I do think it's encouraging, once a month, all the county chiefs and the sheriff, we all meet for lunch. And we actually, this is a regular point of conversation amongst all of us, as it was yesterday. And we were specifically talking about these numbers and what we're seeing. And I think one of the more encouraging things is that we're seeing less overdose of the less than 30. Less teenagers, less 20-year-olds. So I do think all of the conversations and all of what's happening in the schools is making a difference. Where they're understanding that, one pill can kill you. And so my hope would be that in 9 years, 10 years, that all of the other prevention work that is happening will help this crisis be less. So that is my hope. My hope is that we don't see where opioids are overprescribed, which is where this crisis started, that as a country and as a city and as a county and all those different pieces, that we actually make significant progress where the prevention programs and all the other pieces that we're doing make it where, these conversations are much less, and we move on to whatever the new world problem is, because there'll be another one. There'll be another, as we see this, we see other drugs and other things coming back, because we're starting to see more methamphetamine and other things coming back. That's just, unfortunately, that is the nature of human nature. But that would be my hope, is that as we move forward, hopefully we actually make a dent in this crisis, and the prevention programs and the things that we're doing work. That is truly my hope. I mean, maybe I'm just, have an unrealistic view, but I have to hold out hope for all the work and everything that everyone is putting into trying to really deal with this crisis.
Commissioner Hill?
Just one question. The first section, the high impact abatement areas, is that an area that is part of the focus of the police department, or is that being handled by others?
No, that's a focus of the county.
Okay, thank you.
So what I'm hearing is that the greater availability of Narcan is causing reduced calls for service, specifically for fire and medical.
That's what we think.
Okay.
Like, there's not really a way to know at this moment. That is anecdotally what we think. I can tell you, we with our community partners, even, we have relationships with the folks at UCSB and City College, and it's available, Narcan is available on all campuses. And we had a conversation at the last Fighting Back Coalition about how we can capture that information, about how we can get folks to actually self-report that they administered Narcan, because there is a lot of that, and there's no way for us to necessarily capture that. So anecdotally, we think that's what's happening. Now, whether that's actual fact or not, time will tell. But that's what it appears like to us at this point is anecdotally, and for me, the thing that matters is that the Narcan is being given and lives are being saved. That doesn't need to be a call for service for us, right? That is the whole point is every life that is saved, that's what we want. So, you know, if that is anecdotally and actually what is really happening, that's great. I mean, yes, we would like to see it stop, period.
Yeah.
But anecdotally, the more that we can get out there, the more that's available, we know that that is saving lives at this point, and that's the most important piece.
I appreciate the demographic data that was collected. I personally love demographic data when it comes to things like this. Is there, or have you been able to collect data on folks that have received Narcan through SBPD or fire, those that are housed and those that are unhoused?
So that's an interesting one, because yesterday during the conversation we had at the chief's level, that is, the sheriff's department is trying to break down the data much more granularly. So we've asked to try to get it based on per city and unhoused, I think, let me check my note. I think, so far for 2023, there's been 37 fatalities that the way it's been captured by the coroner's office as unhoused. So I think.
Countywide?
Yes, countywide. So that's of the, what number do we give, 140? Yeah, about 25% so far this year has been unhoused.
And is there a deadline for spending the funds once you receive it?
There is a little variation depending on which settlement it is, but it's usually within 5 to 7 years that you have to spend the money from the year in which you received it.
Okay. And will you be partnering with CBO, community-based organizations? So if an organization has more contact with a certain population that may not feel comfortable coming to SBPD, watch the video or so forth?
So we want to make sure that we're providing another outlet, you know, like with Pacific Pride in different ways. So we're still working through what that would look like with our community partners. We know a lot of people will, for different reasons, feel like they can come and they want the information. They don't just want a packet. So I, you know, the numbers that have been coming into the sheriff stations are very encouraging. So, you know, Pacific Pride and some others do it in different ways. So we want to make sure we're maximizing the most use of this. So I don't have a specific, you know, formula for that at this point, but based on the success that we're seeing within the sheriff's department and how much folks are actually coming into the stations to receive it, our intention is to start there and then, like I said, work with Pacific Pride and some others to really lean into it.
And Chair Rodriguez, I wanted to add too, that's another point of reference for all of you to let us know. If there's organizations you feel are reaching a population that has been otherwise underserved, right, inaccessible for a lot of reasons, please share that with us, both the department staff as well as city administrator's office, because we want to get to know those partners and be able to engage, learn from them. There's multiple points and multiple organizations that are working to deploy Narcan and make that accessible as possible. Pacific Pride is actually continuing to advocate that they should not be the organization that's primarily distributing Narcan and for free. So their contract is up, I believe, in 2 years, and the outgoing CEO has been communicating far and wide that they really need to look at multiple organizations receiving that contract through Public Health Department to be distributors.
I'm glad you mentioned that because I was going to state that I would like to see this more readily available in all organizations because I think there's a stigma, I think, attached when it's linked to one organization both ways. That stigma is there. I'd like to see it everywhere. I think I read somewhere that just like we have the tiny libraries, that there were communities that are having libraries of Narcan available for folks to just take as they need.
And Chair Rodriguez, the last report, I think Pacific Pride Foundation distributed 4,200 doses countywide for free of Narcan to organizations to then distribute or to individuals themselves directly.
My last comment or question is, I believe what may have been asked about the county plans. Can you talk a little bit about Project Opioid? And I believe that's the county strategy, and if you're formally or informally linked to that.
So there's multiple folks in the county working on the same thing. Project Opioid is a little different. Commander Hill attends all the Project Opioid meetings on behalf of the department so that we are in the loop when it comes to that piece of it. But I do know, and Commander Hill can also speak to it, there are, I don't want to get into what the county's doing, but there are different pieces of that within the county. But we actively participate in all Project Opioid meetings. Commander Hill is our representative on those meetings. But that is primarily pushed by the Sheriff's Department as well.
So who should the public or organizations reach out to if they have input on this?
They can reach out to Commander Hill. We can provide his email address, and that's the best way to get in touch with him. They certainly can email, and that's the best way to send the comments and anything in terms of the public comment. So we will make sure that that is available. It's very easy. It's shill@sbpd.com. So, but they can always, it can always come in through the city administrator's office and through Ms. Anderson, but they will all go through Commander Hill.
Thank you, Ms. Peterson, Commander Hill, and Chief Gordon. Are there any other questions from Commissioner? Do we have any public comments in person or online?
Chair Rodriguez, we do. We have both online and in person. First comment, Gail Oshenko, please approach the podium.
Chair Rodriguez and members of the commission. My name is Gail Osherenko. I'm a resident of this city. I'm also a member of the board of the League of Women Voters of Santa Barbara, and I chair our Criminal Justice Reform Task Force. But my remarks are my own today, informed by the work of our task force, and we work closely also with CLUE, Clergy and Laity United for Economic Justice. We are largely focused on issues in the jails and also in reducing the number of people who spend time in our jails. And we're particularly focused on mental health issues and getting severely ill or people with mental issues out of the jails and getting them treatment in the community. So that's really why I'm here today. I guess the basic question is how the various departments, and you guys have asked this in some ways already, how the various departments of the city and the county are coming together to solve this problem. And my understanding, which is pretty minuscule, I learned a lot here today, which is really good, is that the county has kind of got public health in the leadership position of organizing this effort. I don't know if you can confirm that or not. Yeah, I'm seeing a nodding head. So we really like that. We really like to see them in charge and coordinating this collaborative effort, and we like to see as much collaboration as possible, and as much of that including the public, and making presentations like this and more detail available. I believe our city police chief and a lot of the officers understand that more arrests of local dealers or those in the throes of an opioid crisis are not going to end the crisis. And we need this coherent countywide plan. We need to expand 5150 authority to our well-trained city police so that they can get people into mental health treatment more rapidly and not take them to the jail. We really think that if your commission and the police and fire can support programs that have a track record for ending addiction, that this is critical. I mean, Narcan is going to save lives, and education is going to get people to understand they shouldn't be taking these drugs. But there are some programs that are effective. One of them is the MAT program that was mentioned. And just give me a half second more. I know for a fact from being on the grievance committee of the sheriff that there are 20 people in the program in the jail, but there are 20 more on the wait list. So getting the money into the programs that work will really help. And thank you all for what you're doing here. Thank you.
Thank you, Ms. Osherenko.
The next public comment is online. Suzanne Riordan.
And I forgot to mention this before, public comment has 3 minutes. We can hear you.
Yeah, great. First of all, I second all the remarks, the very good points that Gail Osherenko just made. We're working together on, on so many different issues, including what's going on in our county jail. And we're very alarmed by the number of deaths that are occurring there, and a number of them are related to fentanyl overdose. And so, but that's a county issue. I'm curious about the relationship with Pacific Pride. They have their own source for Narcan and I guess fentanyl test strips. Is that correct? They have their own source. Is that correct? And they want to, they'd like to not be so involved in the future. Can you confirm that for me? And can you confirm whether you can use some of this money for fentanyl test strips as well? And then I find it, for a lot of people that need the Narcan and the test strips, I think it would be very daunting to go into the police station or the sheriff's department. So I think providing it in other ways, that's one thing I like about Pacific Pride. It's not so scary to go there, I would think. I want to make sure that it's provided in places that are not going to be, frightening to people who need it the most. I work with Families Act, and we're a group of family members who are quite concerned about our own loved ones, who tend to be young adults cycling through the system who have a variety of complex mental health issues. But I'm very glad to hear that there are funds available and that they're going to be distributed to the people who need them, which is everybody in our entire community. And I'm wondering about whether fentanyl test strips will be part of it.
Thank you, Ms. Ryerdeck. At this time during public comment, we can't answer questions, but at the end, there might be opportunity to answer general questions. Any other public comments?
Chair Rodriguez, we do not have any more public comments.
Are there any other questions or comments from the commission? I had one more that I forgot to ask, and that was, is there liability to administering Narcan?
No, there's not.
Okay. Thank you so much for your presentation. This was very informative. Thank you. And very important.
Item 8, Community Partner Presentation on Youth and Substance Abuse by Council on Alcoholism and Drug Abuse.
Good afternoon, Chair Rodriguez and Fire and Police Commission members. I just wanted to take a moment to introduce our community partner, the Council on Alcoholism and Drug Abuse, CADA. Ms. Kerwood is the Director of Youth Treatment Services at CADA. She's in charge of youth services countywide, including the 3 Daniel Bryant Youth and Family Centers. Michelle is a licensed marriage and family therapist and has been working in the Santa Barbara community at CADA for 18 years, several of which she was stationed at local schools. We also have Ms. Capristo, who's joining her, a family therapist and clinical supervisor at CADA. She's a licensed clinical social worker and has held positions in Santa Barbara with CALM and Santa Barbara Neighborhood Clinics before joining CADA's multidimensional family therapy program. She works closely with families and with therapists, providing services to our families countywide. Thank you so much for taking the time to join us today.
Thank you. So we're here today to tell you a little bit about, what did I do wrong? About our programs and about what we're seeing with the youth in our community currently. As mentioned, we come from the Daniel Bryant Youth and Family Center, which is the Council on Alcoholism, Drug Abuse, youth serving or arm in Santa Barbara. So we have 3 different, there we go. Follow along now. So we first wanted to give you a little bit of information about what we've been seeing, and a lot of this is more anecdotal. We do serve county-wide, but we're trying to focus specifically on what we're seeing here in South County and in Santa Barbara. So traditionally, over the years, cannabis has been the most common drug of choice, and also we see alcohol as well. And we're still currently seeing that. We're also seeing a lot of vaping, both tobacco and cannabis. But we've also seen that increase in opioid use and opioid use disorder, especially in the past 2 years. We are grateful that here we haven't seen it like as much as we have in our Santa Maria and Lompoc offices. Those definitely have a higher number of youth coming in with opioid use disorders. We are kind of seeing the average age of first use, be it cannabis, be it kind of any drug, around 12 years old. And our number of youth in treatment has increased. It's about doubled since 2019-2020 year. And it went down during the pandemic because we just didn't have access to the kids, and then it came back up after. And, you know, I think some of that might be a very good thing, that kids are getting the treatment they need, that there's those avenues for them to come to us, but also it's concerning that there is that high level of use. It's hard to tell which one is the reason for that.
So I'm going to share a little bit about what we've seen the impacts of COVID had on our youth in our community. So, you know, we are looking back 3 years ago, and the youth 3 years ago missed on formative social interactions. So, you know, 3 years ago, the kids who were between the ages of 10 and 11 are now 13 and 14-year-olds. So those are the middle school age kids who are being seen at our clinics. Those who were in middle school back then are now in high school. So those are the 16, 17-year-olds that we're seeing at our centers. We've seen an increased number of teenagers, you know, presenting symptoms of anxiety, specifically social anxiety, and they're isolating. They're reporting that they're using more of these substances on their own. So, you know, before it might have been socially with more peers. Now it's, you know, I'm doing it alone in the bathroom. I'm doing it alone in my room. So that's concerning. Difficulty, and even in our group settings, that we offer group treatment at our centers, and even getting them to come together in a group setting, we have seen there's been a shift in their interaction in those groups. We are noticing that there's an increase in self-medicating for anxiety and depression, and a lot of the self-medication is coming through the use of substances. And then the trends in treatment that we are seeing in our centers, we are providing naloxone to youth and parents as well. We actually distribute as well. So anyone that could come into our doors, they're welcome to receive it. We also provide a training video in English and in Spanish. We have it available. All of our staff have been trained. We were actually trained by Pride Foundation. They provide the actual training for our staff. And then as staff, we are able to distribute it to our clients. People don't have to be our clients. People can also walk into our facility and obtain it. And if someone is a walk-in, it's usually by word of mouth. It's maybe someone who's a client there, who has a friend who's not necessarily a client, but they know they need it, will come in and just, you know, we don't ask any questions. We have them sit down with one of our staff members. They watch the video. We distribute it. We just have them, we have a sheet where we just say, all we need is a name, and that we collected it. and that's it. Just so we keep a count on how many how many have been used in the community. The issue is we don't hear back. If we have the number that they take it, we don't have the number if it was actually administered, unless it's a client who then shares with us. We also, another trend we're seeing, our programs are outpatient services. The goal is to keep kids out of residential or partial hospitalization programs. We are seeing a higher need to send some of our youth into higher level of care. And that's usually kids or youth who are more in-depth into the world of substance use, have an actual DSM-5 category substance use disorder, and the level of care that we provide is not sufficient for their level of functioning needed. So then at that point, we work with Be Well, and we collaborate, and we find the appropriate treatment setting for a youth.
And just to add to that, there's a program with the state of California that provides substance use treatment facilities with free naloxone. And so that's where ours are coming from and why we're able to distribute it. And also just to add to, we mentioned Matt earlier, we work hard for any youth that comes into our program with opioid use to connect them to medications for assisted treatment. It's showing more and more that should be the first line of defense, especially for youth with these prefrontal lobes, not quite developed and really needing that to get over the urge and the impetus to use. So now we wanted to move into some of the things that we're doing and the good news, the positives about how we're helping. So I mentioned our Daniel Bryant Youth and Treatment Center. It's right up the road here. We walked on over from 1111 Garden Street. As I mentioned, we also have offices in both Lompoc and Santa Maria. We pride ourselves on being kind of a hub of support for youth and families. We have the outpatient substance use disorder treatment. We have our diversion program. We offer parenting classes. We have therapy services for kids who are dealing with co-occurring mental health and drug and alcohol disorders. And then we're also kind of the home base for some of our services that occur in the community. We are the only substance use disorder facility that is serving youth with Medi-Cal in the county, and we are definitely the largest server. I'm going forwards instead of backwards, sorry. Where do I go? Yeah, she's smarter than I am. We serve youth and transitional age youth, so 11 to 21 years old. Daisy mentioned some of them meet criteria for substance use disorder diagnosis. Others don't quite. They're starting to use, they're experimenting. Those we can provide early intervention services for. And then once a youth has completed our program successfully, we're also able to offer recovery services just to kind of keep checking in on them, making sure they're doing okay. We mentioned the anxiety and depression that we see a lot of, so we help youth who are coming in with both those co-occurring disorders.
Majority of our referrals are usually through our diversion programs, which is the schools, parent and families. They word of mouth, they call us, or someone's like, a parent is, I just found my teenager experimenting. What do I do? I'm freaked out. What does this mean? And they usually call us, and then we provide services. Juvenile probation, we have a high number. We have a collaboration with juvenile probation, and they will often call us, consult, and even ask us, is this an appropriate referral for your agency? Is this appropriate treatment? So we collaborate with them as well. The Be Well, the access line for behavioral wellness, we work with them closely. And then also we have walk-in and word of mouth and community outreach that we do. That's how we get our clients into our doors. And then one of the modalities that we're using is the multidimensional family therapy. We offer it at all of our 3 locations. It's one of the gold standard youth treatment for substance use treatment. We focus on 4 domains: the youth, the parent, and the family and the community. And we integrate it into the treatment of substance use. So what that entails is clients and families are in our facilities with outpatient services for a length from 4 to 6 months. It could be longer. It's very intense. The teens come in twice a week for individual and then family therapy. Parents also come in twice a week for parental and family therapy. And the reason this is gold standard is because we focus on what is happening in the family, what is happening at home that even caused a teenager to even start this path. And it could be someone who at one point started experimenting, but slowly it creeped up on them, and now we're in a deeper, need for services. We've seen very successful families with this treatment, and this treatment is actually designed to keep kids from not going to residential. We don't want to give the message, oh, you're using, we got to send you away. We want to send the message to the child or the teen, hey, you're using, we're here as a family, we're going to help you through this together, and we're going to work this together. One of the main components of MDFT that I really enjoy is we teach parents, you're the medicine. You're the medicine for the healing of your son or daughter, and how are we going to all work together? So I've seen great stuff come out of these treatment model, and that's one of our gold standard youth treatment that we're currently using. Given the length that it takes, 4 to 6 months, we do sometimes have a wait list, but even those who are on the wait list, we're still serving them. We'll serve them just the individual treatment, and then when there's a spot available, we'll move them into the family treatment component. For all of our services, we accept Medi-Cal, San-Cal, and private insurance. Co-payments or additional costs are actually covered by our grants and scholarships, so our families actually don't have to pay. We have a SAMHSA grant for MDFT, and that's a co-collaboration with UCSB. So we're actually also collecting pre and post data for this particular modality, and parents who are participating are providing unidentified information so we can determine how they feel about the treatment as well. And that's a 5-year research project. We're starting year 3. So I'm excited to see what the data comes out of that once we complete it. So most of our grants cover services for people who are either private pay or don't have Medi-Cal. So we don't turn anyone away for not being able to pay. And we also have parenting groups, and it's called Parenting Together or Padres Juntos. And that is a very successful parenting. We have it in English and Spanish. They're in the evenings. They're hybrid. Lino does the Spanish on Mondays, and one of our therapists, Hannah, does the one on Tuesdays. And they're hybrid. Families can come in person, and others are via Zoom. We have a big screen just like this, and people engage, and it's a very successful, it's an ongoing, it's not a closed group. The uniqueness from this parenting group versus other CBOs is that our staff incorporate the effects of substance in the teen's developing brain. Other parenting courses may focus on the attachment, on the union between families. We focus on that too, and we also focus on how does a parent address substances once they find out their child is using. And I think that's a difference between other parenting courses out in the community.
So the other bigger program that's housed through our Daniel Bryant Centers is our diversion program. And so our diversion program, the intention is to divert kids from the traditional punitive juvenile justice system and really do more restorative approaches to what's been going on. So instead of giving them a punishment for what they've done, trying to figure out what the underlying need is and addressing that instead. So this is early intervention services and low-level offenses. We don't get kind of the higher needs kids coming to us. You guys may be familiar if you've been in town for a long time with Teen Court. Teen Court is kind of our long-standing diversion program, and what we've done is combined that with a program we had through a grant with Santa Barbara Probation Department to to kind of use the great things that Teen Court was doing and the wonderful things that this YES program was doing. The YES program was doing these screeners to try to determine what the underlying need was. So now that we've been able to kind of merge those two together, we feel like we have a really great diversion program. We do an intake with the youth as soon as they come in, with the youth and their parent, and we do a screener, and that screener kind of tells us, hey, this family's having these issues, maybe this youth has a history of trauma and they need this intervention, maybe they have problems with mental health issues and they need those kind of interventions. So it helps us to determine what their needs are, and then we create with the youth and family a restorative action plan. And that helps us to identify those services, then they receive those services, and hopefully we send them back out into the community successful, and we don't see them again. So it's usually 3 to 6 months, and we try to give a lot of incentives and rewards for completion. We've been able to contract or to work with some of the local school districts, and that has been a really great thing too, because then if there's a problem at school, they come to us. The schools can also help us incentivize their completion. We are really, really proud of this program. We use evidence-based interventions. It's supported by school districts, by the probation department, by kind of a lot of different organizations. We individualize it for the youth. We are trauma-informed and culturally sensitive in getting these kids the needed services. So you'll hear I'm passionate about this one as well. And yes, that's the gist of our services, so we'd be happy to take any questions.
Thank you. Commissioner Hurlinger?
What percentage of your funds come from SENCAL?
I don't have it in front of me, but I would say probably 60% of our our youth that we serve have Medi-Cal. And so it's actually not through SENCAL, because alcohol and drug services are through behavioral wellness, so the county behavioral wellness. So I would say 60% of our youth have that.
And then how does the rest of your funding break out?
Daisy mentioned the SAMHSA grant, so the Substance Abuse and Mental Health Services Administration provided us a large grant for the MDFT program, and then we do smaller community grants with local foundations, and our board is pretty good at getting us some funding too. I don't know if I'm allowed to say this here.
So you have a bottom line, basically.
We have the Summit for Danny coming up on Saturday at our local climb, so come on down.
Okay. Thank you.
Any other comments or questions from the commission? CADA has a wonderful reputation in our community, so thank you for the wonderful work that you've done for decades and that you continue to do. And I specifically appreciate the idea of family being the medicine. And I would like to think that a caring community like Santa Barbara could be the medicine for youth and adults struggling with addiction. Thank you so much.
And Chair Rodriguez, I just wanted to add, so although not technically under the purview of the Fire and Police Commission, it absolutely is a community partner of both Fire and Police Department to really work closely with organizations like this, share information, share resources. And I know that Commissioner Hill had an experience with youth and substance abuse on his ride-along, so I took that to heart and wanted to go a little bit deeper in terms of this topic. So I appreciate the opportunity to bring in a community partner and to take the time to share a wonderful resource and organization.
Thank you.
Yes, and please don't take our lack of questions as lack of interest. I think we're all blown away by what we just heard, so thank you. Ms. Clerk, would you mind reading the next item?
Item 9, quarterly report of complaints received by the Santa Barbara Police Department.
All right, good afternoon, Chair Rodriguez and the Commission. I'm here with your third quarter report for those listening, I'm going to go over the entire report, starting with the ordinance, which the City Council approved the ordinance of the Council of the City of Santa Barbara, amending the municipal code by adding Chapter 2.09 to assign additional civilian police oversight duties to the Board of the Fire and Police Commissioners in October of 2022. The purpose of the ordinance is to strengthen the relationship between the Santa Barbara Fire Department and Police Department with the community by providing transparent oversight and increased civilian input regarding departmental policies, practices, and procedures. As stated in Section 2.09, under powers and duties, specifically Section B4, the Commission is to receive reports from the Chief of Police or City Administrator's Office that contain aggregate data regarding internal investigations and subsequent employment actions taken. And the reports shall not disclose any information in violation of state or local law. And so the aggregate data for the quarterly reports includes the number of complaints of the department's sworn employees submitted to professional standards on a quarterly basis, and the number of pending PSU investigations and the related policy sections of misconduct that's being investigated on a quarterly basis. So for the quarter, July 1st through September 30th, we have received a total of 12 complaints. 9 of those are citizen, and 3 of those are internal or administrative complaints. The pending complaints, currently we have 10 to 12 of those pending, which means we've closed 2 of them. And the relevant policy sections, I'm going to provide the relevant policy sections of all of the cases. We have 4 cases that are 321.3.2K, which is discourteous, disrespectful, or discriminatory treatment of any member of the public or any member of the department. We have 3 cases that fall under 321.3.5C, and this is the policy: unsatisfactory work performance, including but not limited to failure, incompetence, inefficiency, or delay in performing. We have 3 cases that fall under 321.3.3A, which is to discriminate against any person because of age, race, color, creed, religion, sex, sexual orientation, national origin, ancestry, marital status, physical or mental disability, or medical condition. We have 1 case that falls under 403.3 of the policy, which is basically the first officer on scene of a crime or major incident is generally responsible for the immediate safety and the preservation of the scene. And lastly, we have 1 case that falls under 321.3.8B, which is failure of a supervisor to timely report known misconduct of an employee to his or her immediate supervisor, or to document such misconduct appropriately as required by policy. I'm happy to take any questions.
Questions from the commission? Commissioner Jones?
Thank you. Thank you. I just had a question about the one case, 403.3. Compared to the other cases, this one is, it seems more of like a, it's a more of a declaration, like so that like the first officer on the scene is responsible. But what, can you unpack a little bit more, like what does that mean? What is the issue by virtue of that?
So typically when we look at these, we look at what the policy, the most appropriate policy violation. Ultimately, there's usually multiple policy violations in something like this. So a violation would be of this policy is the officer did not do that when they arrived on scene. So, you know, we could give a short, but we're just trying to be give as much explanation as we can when we give the policy violation, so that we're not just leaving you wondering. We're trying to make sure that we're providing the whole policy section. So often there are multiple, you know, with one, but we're trying to provide the, what I would call the overarching one for each.
Commissioner Jones, we also, when we receive complaints from the public, we don't expect the public to know our policies. So as we analyze those complaints, we apply the most appropriate policies. And as we investigate, sometimes there are more or different policies that come to light.
Any other questions or comments from the commission? My question, I have a couple. Was this 12 total or 12 pending?
So for this quarter, we received 12 total. 9 of those were citizen complaints, and 3 of those are internal or administrative complaints.
Okay. And are any of these complaints from the same complaint? Like you mentioned, a person will come forward and file a complaint, and are any of these like 3 in the same, they're all separate complaints? Okay.
Yeah. So yeah, out of the 12, these are all 12 separate complaints.
Okay. And if I understand correctly, we had 12 total complaints from Q1 and Q2 of this year?
So in total this year, we have 26. So we had 9 complaints in quarter 1 and 5 complaints in quarter 2.
Okay.
We had 7 citizen complaints in quarter 1 and 4 citizen complaints in quarter 2.
Okay.
The other ones are administrative or internal complaints.
So my thoughts on this, so one might say if we had, why are we double in one quarter versus 2 quarters together? And my hope is that it's because the complaint process is becoming more readily available and folks know and understand that they can file a complaint and how to file a complaint. Do we have any way to determine that?
So I can't speak to the individual complaints because a majority of these are still under investigation. I can tell you that some of these complaints are, although they're new complaints, they are over incidents that occurred many years ago. And sometimes when there are things going on in the national narrative in the press, that also causes people to come forward and make additional complaints. So several of these complaints are old complaints that were just brought forward now. Like I said, I can't speak in general about these, but it's not uncommon to see ups and downs with the complaint process, whether some quarters you have more and some you have less. And we look at it in a totality of the year, and we look for the patterns throughout the year because it's hard to just take it from one quarter. But I can tell you specifically with this, several of these complaints are old complaints that were just brought forward now.
Thank you. Commissioner Herlinger?
So you said they're separate complaints, but do you report, like, if there's more than one complaint about either the same individual or, in other words, so you have 12 complaints, 3 of them could be about the same person or situation?
So Commissioner Herlinger, if these are separate complaints, and it's not uncommon for a complainant to complain about an incident and every officer on an incident, that would be considered one complaint.
Okay.
Or to receive 2 different complaints regarding 2 different incidents about one single officer. Those would be separate complaints because they're separate complainants and separate incidents.
Okay, so is there a way to report if there's more than one complaint against, regarding one officer, for example?
So
Are you getting where I'm going here with this, or no?
I'm trying to make sure that I'm answering your question.
Okay, so-
With the information that if we receive a complaint about an officer and they have multiple complaints, those would be multiple complaints. Like, it's not all
Okay.
complaints regarding one officer goes to one complaint. It is one complaint per incident.
I understand that, but then do you report if there was more than one complaint against one officer or one individual? Is there a way that we would know that there is more than one complaint specific to a particular person, not incident?
Commissioner Herlinger, I think, are you asking if there's a way to determine a pattern?
Yeah, could put it that way.
So we look at when we.
Or you could tell me that there's no 2 complaints that are against the same person or incident. Is that-
Commissioner Herlinger, I'll just step in for a minute. So
Okay.
on your annual report, you'll receive information on the number of employees disciplined and the level of discipline based on these investigations. You won't have the access to the names of the officers because
not-
it's confidential, but I do sit down with Commander Corbett weekly, and I do have access to that information. So I would know as the monitor, and we would discuss if there are multiple complaints and investigations involving a single officer
That's what
over-
I'm asking.
over a period of time.
Okay,
Absolutely.
I'm not interested in the names.
But that information, in terms of officer, is confidential and would not be public, but you'll see number of employees disciplined at
And
the
just
end of the year.
to also provide kind of just a bigger picture view too, is when we're looking at discipline, pattern of behavior and conduct is part of that decision-making process when we issue discipline. So although there may be one case,
so.
we look at the pattern of behavior, and if there are multiple cases, that does go into the decision-making factor when issuing discipline. So we do look at those patterns in how we issue discipline as well. If there are multiple complaints, that is all part of what we're looking at. You know, if you get a particular officer and they have, 3 complaints in the last 6 months for discourteous treatment, that is something that,
That would be 3 complaints, though. That would
Yes.
count as 3 complaints.
Yes.
And that's what I'm asking.
yeah,
so,
it's not,
okay.
it's not, every single incident is its own complaint.
Yes, but some could be, 3 of them could be a complaint about the same officer. I don't want to belabor it anymore,
Yes,
but,
they could be.
okay.
they
And
could
is
be-
there a way for us to know that?
I think that what you'll see in the annual report,
If I may step in, I think what's,
Okay.
I think what, in terms of the ordinance, Chair Rodriguez, Commissioner Herlinger, is to get an idea and to get a sense. And so the way the police department has structured it is incident-based. I'll give you an example. You could have something where you have something streaming, a First Amendment auditor, and they may treat someone discourteous. And so it's important to just have it incident-based, because maybe 90 people call in the police department to complain about that officer, but you don't want to capture 90 complaints because that's misleading, right? So it should be incident-based. So what the police department is capturing is incident-based where a complaint was received, right? So it's not, and that way the stats are not skewed. And as the department has said too, in order not to skew stats, 3 complaints against an officer, sustained complaints, it depends, right? If it's over a 20-year career, that may not be an issue, right? If it's over a 1-year period, that may be an issue, right? And that's, as the chief said, that's what we deal with in terms of progressive discipline. Those are factors you look at in terms of the severity, the time occurrence, et cetera. So basing it on incidents is key, because if a complaint's received, it should then be treated as one. It doesn't matter if it's the same incident, you have 5 complaints. You're really focusing on receiving a complaint and the corresponding incident to it. So that way it won't skew the stats.
Commissioner Jones.
I want to follow up on Commissioner Herlinger's question. And I think it's worthy, and I appreciate your comments about the importance of it being instant-based. However, in terms of our role, at least as I'm beginning to understand it, if we have community members who are saying, I see so-and-so, and we've had an issue with this particular officer, right? And we're not going to know that given this reporting. I totally understand that and get that. But what I'm hearing is, and I guess the question that I'm hearing is, even if there's a recurring incidences with the community where complaints are filed specific to one officer, we may not necessarily know who that particular officer is, but will we know that there are multiple complaints being filed against an officer in the force in this regard?
No, you will not.
And why?
We don't break it out by the number of complaints per officer, the way in which we provide information per the ordinance at this point. And I also want to point out that can sometimes be misleading and skewed, because you have certain officers that have contact with particular folks that every time there's a police contact with them, file a complaint, just by the officer's mere presence. So that piece is not necessarily a piece that indicates misconduct. So that's why we look at it in terms of progressive discipline, and we look at the totality of if we have an issue, we're addressing that issue early on to make sure that that conduct does not continue. I am hopeful that when we present our year end, which gives a whole lot more detail, then we can have what I would consider probably more productive conversations, because then we'll have a year's worth of data that we're sharing that is a lot more in-depth and thorough than what our quarterly reports are. And I think that will be the point in time where we can have conversations about what other data we can be providing and how we can provide it. But I would say, you know, there is, just by saying an officer got 2 or 3 complaints in a quarter, that it can be misleading towards the officer, and we don't have a large number of officers, so that, I know that the purpose of the ordinance was to make sure that we're protecting that piece of it as well. So at this point in our quarterly reports, we won't be saying 1 officer got 3 complaints.
And I appreciate that, and I think in terms of trying to like encourage community engagement, the same logic also applies going the other direction.
Absolutely, I totally.
So that's hence my
yes,
question, right? So
absolutely.
if the community's saying, hey, look, you know, we're having an issue over here, and it's legitimate, it's not just every time there's an interaction with law enforcement, I'm filing a complaint, I can understand and appreciate that. But what about the other side of the argument?
I completely, absolutely 100% hear you on that, and that is, you know, where we're working with Ms. Anderson in those conversations, because that information is provided. You know, a lot of those complaints come in, she's seeing the names that are on the complaints and knows that's where that monitoring piece comes in, where she's ensuring that we're doing our job to address those issues if there are systemic issues that is pointing to.
And Commissioner Jones and Chair Rodriguez, it is this place as I stepped into the role as monitor, right? So if I know particular patterns and trends from my civilian oversight role, right, versus the internal oversight role of PD that we can discuss. If there's multiple officers at a certain level that are getting a series of complaints, individual officers that are getting multiple complaints, again, a lot of the discipline is iterative as well. So you will be able to decipher in the annual report, again, the number of investigations, those that resulted in corrective action and discipline, right, as well as the total number of investigations. So number of employees and total number of investigations, you will be able to have access to that information in the annual report. I have access to a level of detail that I can speak to if I communicated in any way throughout the year, if I noticed and observed patterns and trends, and if there was any training or corrective action that we both coordinated and collaborate on implementing. So that is the back and forth that we have in my weekly meetings with Commander Corbett on investigations and complaints received. So I have the officer name, the assigned investigator, and then the result of the investigation as they're completed.
And if I may, Chair Rodriguez, Commissioner Jones, too, I think Ms. Anderson and the chief eloquently stated like what the purpose is and the purview. The purview of the commission is when they come in an advisory role to understand exactly that, trends and issues. Where you look at something like the Civil Service Commission, they actually handle disciplinary hearings. And you will be able to understand more and more as these stats come forth longer and longer to you, because you'll notice that, right? And I think Ms. Anderson keyed on the key issue, right? You're looking at number of investigations or incidences, and then you'll see in terms of correlation how many are sustained. And so that could tell you a bunch of things, right? What's the percentage or average percentage in terms of investigations and actual ones that have been finding that there's a sustained violation of it? How many sustained violations are this year compared to next year versus that? So there's a lot of stats, but those are the most key stats, what's being sustained and complaint and the incidences. Because you base it on complaints and you ask for that number, again, that could be, you could have 95 people complaining about one incident. That will skew the whole, that was my original point, that'll skew the whole numbers. So it's really the focusing on sustained complaints corresponding to incidences, and then looking at it from a longer picture in time, right? Breaking it down to quarters, to years, then multiple years. So, and that was the intent of the ordinance, to notice that and go, well, because if we're having a high-end issue of a number of sustained violations, is there an issue here and why is there an issue, right? And that's where that discussion comes from, a general discussion department-wide versus focusing on a particular individual.
Commissioner Dozer.
I think you pretty much just said what I was going to say, is that, in everyone's right is to make a complaint, but the importance is actually what's the finding? What is sustained? Because that's going to give us a lot of information, and I think it's very correct to look at it over years to see what do we have here? And I think that was what was important in the audit, and I think that's what is important in the year-end statistics. Complaints are, they're great. They might indicate there's smoke, but they might indicate there's absolutely nothing. And so a sustained finding is extremely important. And having just had my ride along with officers and having been in law enforcement, recognizing that certain officers and certain assignments, you are dealing with people where you are putting yourself in a position where you might have a complaint a day, and there's other officers who won't because their assignment is different. And it's a tough job, and yes, the public needs to know, and that's why I think these statistics are really important at the end of the year, so we see what was sustained.
So thinking about the process in which the Community Formation Commission went through to come up with a recommended plan for this commission, for the oversight component, there are commissions where the commissioners do look at each and every complaint, and it is a long and arduous job. It's those commissions get paid, and I've met them, and they're tired, and a lot of them they're retired. They don't have other jobs. I hope that we continue to have this conversation every time we have this quarter report to remind the commission and the public the reason why it's set up this way. If at the end of the year, when we see the year-end reports, and at this point in time, 26 is not a lot of complaints for the size of our city and the size of our department. It's double than it was, last quarter, but it's still not a lot. If at the end of this year or next year or future years, the commission notices a pattern, we see those reports and we say, we're seeing something that's not working, and we're not confident in the practice that's in place now. The commission can offer to the city council to have a different system set up. That would require a citywide election, because it would be removed from the city administrator's office, and that charter would change. So it would be a bigger process. That is always an option. I would say at this point in time, 26 is not something that would trigger that conversation right now. And I love data, so I'm looking forward to the year-end data. And I think at this point in time, this commission has to trust that the monitor that we have in place right now, Ms. Anderson, will step in at a certain point when she feels necessary to say, hey, there's a problem here. This pattern is clear, and this corrective discipline is not working. So we have to trust that, and also pay attention to the data in the year-end report.
And Chair Rodriguez, I wanted to add a little bit to that. You won't see this in the year-end report because it's not the department that we have, but you would see something like 12 complaints sustained for rude and discourteous behavior, right? And if the corrective action or discipline imposed is nothing, you would say as a commission that there's a problem here. Mm-hmm. This is not what needs to be in place. We recommend a different course, right? So you would be able to see something like that. because of just the information that's provided in the annual report. So I just want to be clear to provide an example of, you would be able to see things that really lift up from the data that's available at year end.
And also keep in mind that we can recommend additional training in certain areas. It's not always a discipline against an individual person. It could be an overall, department cultural issue or additional training.
And you will see at the end of the year, all the training, part of that annual report includes all the training that the officers receive. So your annual report will be very, very extensive in terms of all the different pieces that you will see for the whole entire year and the culmination of it. And as part of the internal affairs investigation process, and I think this would be the other point, you're not just seeing citizen complaints, you're seeing also internal complaints, which means we are addressing the issues that don't come to us from the community. You're also seeing the internal complaint piece, which means we are holding ourselves accountable. You're not just seeing that we have, 20 complaints from the community. You're also seeing that we are generating when you see that administrative or that internal complaint, we're addressing the issues that we're seeing internally and holding ourselves accountable through that process. And, because we have body cams, we have in-car cams, that rude and discourteous piece and those pieces that sometimes can be very subjective, we're reviewing that body cam. And, sometimes a rude and discourteous violation could be minor. Like it could be in terms of what they said was not appropriate. There was a better way to handle it. And sometimes that just comes down to corrective counseling. Sometimes, something got the better of someone and we use that as a growing experience. We use discipline. The purpose of discipline for us is to make someone a better employee. It's never meant to be punitive, but we are very intentional about making sure if we're seeing patterns that we're addressing them. I completely hear your point, Commissioner Jones. I completely respect that and hear that. And I just want you to know as a commission, we are very, very mindful of that and mindful of the way we're handling our complaints and the procedural justice that we're using not only with the community, but with our officers. So that this is a fair and the process is, and we're getting better at it. We're making improvements to it. We're not just sitting back and saying we're great, because we're continuing to make those improvements. And like I said, I look forward to the conversation when we do the year-end report, because I think that will be that will give you a better picture of the department. And I'll be the first to tell you, we always have room for growth and improvement, but you really, the level of care and respect for our community that our officers, and more than a majority of the time, show is really, really good. As we watch these videos and watch the body cam, the level of compassion and patience, we don't always get it right. Absolutely not. We don't always get it right. We are definitely not perfect. We always have room for growth, but our officers show a really great level of care and compassion and concern for our community overall. So, but I appreciate that point of view and see both sides of that, so thank you for that.
If possible, if there's a way to do this for a case that's closed, maybe several years closed, if we can agendize an opportunity for the commission to see the process of an investigation so that we can understand the steps that you take and the corrective action that follows.
Chair Rodriguez, that is absolutely under the new duties and authorities of the commission to request that the chief walk through an investigation and you're able to, again, ask questions, be informed just about the process. So yeah, absolutely we can do that.
Super. And Chief Mills, not to put you in the hot seat, but I'm kind of putting you in the hot seat. Do you have a complaint process for the fire department? And is there reporting on that?
Obviously, we don't have an ordinance like the police department has. Our complaint process is typically generated by an email or a phone call to the fire department. What happens is it typically goes to one of our administrative assistants, and then it's routed to whoever is in charge of the division For example, and it doesn't happen, but hypothetically, if it was a complaint about a fire inspector, it would go to the fire marshal. As I'm sitting here listening, in the 3 years that I've been fire chief, I've had one person call and complain, and it was not sustained. The process is, it would go to a chief, it would go to the operations division chief or the fire marshal, would conduct an initial interview over the telephone, and typically we would engage human resources. If we needed to, we would engage the police department, their professional standards unit also. But I can just tell you in the last 3 years that it just hasn't happened.
Because everybody loves our fire department. Do we have any other questions or comments from the commission? Commissioner Herlinger.
I'm very familiar with complaints systems, from being from healthcare, but from patients and community and employees. A complaint system doesn't necessarily have to be about a person doesn't have to be involved. It can be a complaint about a process or something, and it's an opportunity for improvement. So I think we have to always keep in mind that complaints we used to refer to them as nuggets of gold, so that we could take the complaint and use it to improve. So I don't want to give the impression that, like we have a complaint system and it's just, it's against officers or it's against something like that, so.
We've had one recently that the complaint wasn't actually about the officer, it was about a process.
Right.
In relation to a process. And in the end, not even our process, but we're involved in it. But when those come through, we do look at, is our policy appropriate? Do we need a change in process? You're absolutely right. There's always a nugget, right? Whether it was sustained, non-sustained, there's always something to take from them, which is why we are also engaging our officers in the process. And, Commander Corbett sits down with an officer on every single complaint and talks to them after it's been adjudicated about what that process, because there may be something where the complaint's not sustained, but there may be somewhere there's a learning lesson. So those learning lessons are still addressed with the officers. Or it may be an opportunity to actually give the officer accommodation for their behavior, because when we watched the body cam, they showed a level of patience I may not ever have. That's the reality of it. So there are lots of different opportunities. There's an opportunity for corrective counseling. There's an opportunity for corrective action. Whatever the appropriate level of discipline, but there's also a chance to make policy adjustments, procedure adjustments, because those things do come up with it. And there's also an opportunity to acknowledge really good work with it, because sometimes that's how we don't necessarily see everything. So it may be the opportunity to really acknowledge a level of work and a level of patience by an officer, or de-escalation, or whatever the case may be. Because sometimes it's just, there are complaints where they're just not happy they didn't get the outcome that they wanted. They had a bad day, right? And so there is a back and forth with that, but there's a lot to learn from each of them, so.
I'd like to add that the chief is correct, that I sit down with all of the officers that receive complaints and we discuss them. And I've been really heartened to see officers more often than not, even in not sustained or unfounded complaints, say, what could I have done differently? Is there something in reviewing this that I could have done differently that would have left the person, not unhappy or feeling better about the contact? And so they're really reaching out for growth and advice, and especially our newer officers. And so, I've been really pleased to see that. That's more often than not the result, even if the complaint is not sustained or unfounded.
Do we have any public comments on this item?
Chair Rodriguez, we do not have public comment on this item.
Super. And I have a question for Ms. Anderson and Attorney Doimus. It is 6:12 and we still have one item left. This item is not due to City Council until March. Do we want to continue forward, or do we want to put this item on November's agenda? Commissioner Hill?
I have a speaking engagement at 7 o'clock with about 40 people who are already assembling for that, and if I'm late, I am toast. So,
And we entertain a motion to move it? Do you wanna
Yeah.
do that? So I'll make a motion that we table item 10, is it? Until the next meeting of the commission.
I second that motion.
Fantastic. Should we take a vote? Oh,
Motion passes.
okay, so if there are no objections, thank you, everybody. We will adjourn today's meeting of the Fire and Police Commission at 6:13 PM. Thank you, everybody.